Okay, back at 1550, something a little different for video 48, thanks to Netix Pro Gene Romenko. Today I'm going to cover 48 of the topics I left on my my little list that I didn't get to cover. I'm going to cover all these in detail again over the summer. But just for the final, one of the final videos, challenge myself a little bit to quickly look at symptoms, treatment and prevention where appropriate. Some of the diseases affect the herd and flocks, and then specific to sheep, dairy and beef. Okay, Listeriosis, it's a bacterial infection that causes meningitis in sheep and cattle. Farmers will be very familiar with it. Again, the symptoms often called circling disease because it affects one side of the brain. You get ear drop, facial paralysis, and eventually these animals will circle around. Treatment involves heavy dose of intravenous antibiotics. The earlier we get them and the more aggressively they're treated, the better the response. Prevention is about understanding where listeria is. It's in soil, it's in mouldy silage, so anytime we can reduce the risk, particularly with sheep at a certain age where their teeth are erupting, they could be at risk. CCN is B1 deficiency, so B1 is an interesting vitamin because it's synthesized only in the rumen. So the symptoms we see are meningitis-like symptoms in calves and lambs particularly. It can be head gazing, they can be down, and we'll see it over the summer months and we're seeing more of it. Treatment involves injectable B1 on a regular basis, and I often use steroids as well. And prevention is about understanding that it's synthesized in the rumen, so it's something, if we're seeing a flock or a herd outbreak, it's really to do with big dietary changes in the 10 days, 14 days before that. And often that occurs when we move from maybe bare pasture to lush pasture with young calves or lambs. Rumen fluke is a stomach fluke, affects the rumen. The adult rumen fluke does very little damage. The clinical symptoms like scour are shown by the immature fluke travelling through the lining of the gut. Treatment involves oxyclosinide, and be very careful. It's a very narrow therapeutic window, so you can cause severe side effects if you overdose cattle that are infected. Again, and sheep. And so again, to control a rumen fluke is about understanding the risk in your farm and then manage the parasite, particularly during winter housing. Smallenberg, we've seen it over the years when it came first. It causes, I suppose, the typical symptoms we saw was abortion. If the virus affected cattle and sheep at a certain stage of pregnancy, these malformed fetuses and abortions themselves. There's no treatment, but prevention, because the midge is involved in transferring it from one animal to the other, is fly and midge control, and it's probably disease that will probably cycle like the Arbicane virus every 3 to 4 years. Liver fluke, big issue in our grazing systems. Again, symptoms in cattle can be chronic weight loss, poor immunity, it's often subclinical, we won't see this. In sheep you can get acute fluke and sudden losses from bleeding. In certain farms it's a big challenge. Treatment, there's a number of flukicides on the marketplace. Understand what stage of liver fluke in the liver do they treat, what time of the year you need to do it, look at withdrawals, look at your own farm risk, and with some grazing management a long-term strategy can be put in place. Lungworm, big issue, I'm going to sort of cover it in my blog tomorrow again, but coughing cattle, coughing young stock, coughing in sheep is one of the main symptoms we associate with it. Not always coughing, but typically. Again, treatments, most of our wormer products will treat lungworm. One of the challenges I'd have is lungworm opens the door to other infections like viruses and bacteria. Be mindful of that, and if you have heavy lungworm infestation, be very careful that you don't cause an anaphylactic reaction with those dead fluke or dead lungworm in the lungs. Prevention, grazing management, good control of, good use of antiparasites, keeping a close eye on the weather. Vaccines have a big role to play, I think, in the future, lungworm vaccine with this disease because it can be unpredictable. Umbilical hernia, so I got lots of requests and lots of queries about these topics throughout, and I did try, I was hoping to cover a lot, but I didn't. Umbilical hernia, so hernia is a protrusion of tissue or maybe guts through the umbilicus of the calf or lamb, and it's often mixed up with infections or particularly abscesses or naval infections or umbilical infections. So you need to feel them, see what they are, and it's basically where the umbilical hole is a little bit larger. It should be a protrusion of guts or gut contents. It really, surgical correction, if they're any of size at all, is the way to go. Prevention, understand that they're genetically most likely to inherit it, so be careful with breeding animals who've had an umbilical hernia. Cold in lambs and calves is a big one. Symptoms with lambs, they have brown fat. When that's burned off, the immunosuppression that's caused by hypothermia is still a big killer in lambs. Have your warming box, get your colostrum in there fast, manage your weak and your triplets and your weak lambs. Calves, again, the same thing, heavily affected by cold, cause immunosuppression. More milk, calf jackets, they all work well in plenty straw. Black red Clostridium shavoi, common in a lot of our soils. Clinical symptoms of it are animals will often be found dead. If we're not, this type of bubble wrap sensation underneath the skin, sometimes we won't always see that. If you do get them, high doses of intravenous antibiotics and penicillins is what I have used. Very variable success rate with treatments. Prevention is all about vaccine. The vaccine is not very dear. It's an issue because a lot of our farms, I would say lambs and calves, at a minimum get their blackleg vaccines, which is a multiple of Clostridial strains inside them. Cobalt is a big issue for lambs. It's an interesting trace element because it's involved in the synthesis of B12. B12 it plays a key role in gluconeogenesis and energy metabolism. And for lambs, it's really important. We can see loose fleece, poor thrive during the summer. Calves as well, it could be an issue with growth in young calves. So cobalt supplementation is one thing to do when we see ill thrift in lambs and calves. Selenium is involved in immunity with vitamin E. So it could be a range of symptoms we'll see with that, from maybe issues around calving time. It's been linked as a small component in retained cleanings, calf health. So it's just an important mineral to get right. It can be toxic as well, so you need to know your levels on the farm, and that's what all these minerals I think is really important. Pinkeye is bacterial infection of cattle and sheep, and there can be a number of bacteria involved, but ultimately you'll see that whiteness in the eye that can come to a point in sheep, and the treatment for it is obviously topical antibiotics or subconjunctival injections work well. Stopping the spread is important. If we have close contact over the winter period, this can be a challenge. When you get an outbreak of pink eye, you tend to need to go through the flock. It's particularly issue with flock because sheep don't develop an immunity to it, and treat aggressively the affected animals to try and reduce down the spread. Iodine deficiency, again, iodine is linked to immunity. We can see it with stillbirths. So if you calves born dead or weak just at the point of calving, iodine is something that we need to look at. Supplementation varies farm to farm, how you get it in, but it's an important mineral to get right, particularly around calving time with lamb and calf health. Lead poisoning causes huge hyperexcitability. We often find these animals dead. Again, it's a differential for sudden death. Very difficult to treat. Calcium EDTA intravenously was the treatment. It's years since I've seen it on the market or used it, but lead poisoning, if you find animals down or you have large outbreaks of animals dying, it's one of your differentials. Walk the field, look for that lead battery. Leptospirosis, again, it's a bacterial disease, causes lots of issues. It's endemic in a lot of our herds, so I would say it's zoonosis as well. It can be spread in urine, particularly risk for dairy farmers in the pit. Vaccine is not overly expensive, and I think because it's so endemic and can cause the milk drops and sick animals, that it's one of those must-have vaccines in our farms. Martellaro causes it's a bacteria. It's a coil-shaped bacteria that causes spirochete, it causes lameness in cattle, and really it's the back of the feet we typically see these lesions in. There's 4 stages. When they're chronic, they're quite crusty, they're very difficult to treat. The earlier we spot it, the better results we get with treatment. Individual treatments work better where we apply topical antibiotics or wraps. Control then involves good foot bathing, and if you don't have this issue in your farm, don't buy it in. Let's go to the sheep side of the house to do a few topics. Fly strike, very topical now from this time of year on. Flies like SH1T, they lay their eggs, and those eggs develop into maggots, and those maggots can eat away and do a lot of damage. So we know the symptoms when we see them. So we want to minimise down the risk by treatments really involve just cleaning the area, dagging and topical antibiotics. But we want to minimise the risk down by keeping lambs in particular, sheep dagged, clean and parasite free, that they're not scouring. Topical spot-ons work well to control fly strike. Twin lamb disease, again it's an energy deficit in the ewe as she comes up to lambing. She's a large number of fetuses, particularly that's a risk. She's a big room and it's a lot of space in there, so her ability, her appetite to eat is going down, and her energy, those lambs are growing, 75% of their growth occurs in the last third of trimester, so really it's getting energy right. Treatment, again, glucose products, propylene glycol based products. Netics have a super products which I use in practice for this rapid collate. But I suppose the key thing for it is that's the treatment, is about prevention, is looking at the ewe's diet before she lambs down and not having a high incidence, particularly knowing the parity, knowing the value, the energy value of your feed, and how you need to supplement ewes as they come to this risk period. Enzootic abortion, again caused by chlamydia. Nasty abortion in sheep causes stillbirths, abortions, can have lambs born weak, and really it's highly contagious, so any aborted material can shed it or spread it, and we can spread it on the farm. Again, most likely sources bought in ewes if you're going to get it. There is a vaccine available to control it, but with carrier ewes they can still abort, so it can be frustrating, but vaccination is the way forward with enzootic abortion. Caseous lymphadenitis, it's Corynebacterium pseudotuberculosis. that I'm delighted myself getting that can cause this infection. Again, it's a chronic disease, it's an iceberg disease in sheep affecting the lymph nodes, and we typically see the lesions like abscesses on the neck and head, and that's how they spread it to each other. And once diagnosed in a flock, you need a control program. It can be difficult to manage, but removing those chronically infected sheep is really important. Toxoplasmosis, again, another abortivation in sheep, spread by the cat acts as a host. Doesn't get clinically affected, but acts as a host. When the infected cat feces is ingested by sheep, they can abort. We can have stillbirths with it as well. Typically no treatments for toxoplasmosis. Unlike in zoonotic abortion, you can treat in context, but toxoplasmosis, it's good to get a diagnosis because vaccination is very effective against it, and it's often just a yearly vaccine where we do our replacements. Yetski disease is a hard one to pronounce. It's a viral disease that affects the lungs of sheep, pulmonary adenocarcinomas. And again, this is a chronic wasting disease, often mixed up with pneumonia in sheep and flocks, becoming more common, where you get the development of pneumonia-like symptoms and these sheep just fade away. And often there's the wheelbarrow test where you lift them up on their front legs, their fluid will pour out of their lungs, and post-mortem is often where we diagnose these. Control of the flock is really difficult, but and getting more popular is the scanning of lungs to identify carriers and remove them. It's a slow process. Toe fibroma, do see this a bit because it's overzealous use of our pairing, particularly if you pair off and get bleeding at the end of the toe of the sheep. You get granulation tissue, and that granulation tissue will get very sore. Ever cut the top of your nail? Very sore, and sheep will be very lame with it. So avoid overzealous pairing if you're seeing toe fibromas. Very little you can do to treat them. Pasteurellosis, again, is pneumonia in sheep. It's caused by the Pasteurella bug. That Pasteurella bug is in a lot of the tonsils and the upper airways of healthy sheep, and it's usually stressors that will cause proliferation and the symptoms of pneumonia. We'll typically see it in lambs, we can see it in store lambs. Vaccination works well for me in these cases where it's been diagnosed. It's just an effective vaccine. Vaginal prolapse in sheep, the last sheep topic, very common one, lots of questions about this. Vaginal prolapse can be pre-lambing, can be a real headache for sheep farmers and a real welfare concern for the sheep. So it's about minimising down that. Understand the risk that sheep's abdomen is not a whole pile of space in there. As the lamb gets bigger, that pressure can push on the vaginal wall. So all I always think about when I see an excess number of vaginal prolapses, I think about muscle weakness. So I actually think about calcium pre-lambing, and I've had success managing that. I would look at body condition score, feeding, and any issues with housing that's causing bullying or stress that could increase the risk there. So that's vaginal prolapses. Dairy side of the house, Q fever. We're going to hear more and more about this Q fever. I suppose it can cause abortions in cows. It can cause a number of symptoms, very common around the world. It's spread by ticks. And why it's particularly significant is it can affect humans, and it causes zoonotic issues, so it causes flu-like symptoms in humans. So the tick is really key, and I think the tick in a lot of diseases, I probably haven't mentioned it enough throughout the series, tick populations seem to be increasing. We're seeing to see more tick-borne diseases in all our animals, and Q fever is one to watch out for, and I'll probably cover in a lot more detail over the coming weeks and months. E. coli mastitis in cows, again, this is a toxic mastitis. This is the E. coli bacteria getting into the other, overwhelming the immune system. The toxins released from the bacteria as it dies causes this shock. So we'll see watery mastitis. Cows can get very sick with it. And I suppose when we look at treatments, it's about reversing shock. Fluids. Your vets would give intravenous fluids, stomach fluids, anti-inflammatories, particularly the likes of Phenixin, which has anti-endotoxic shock properties, covering antibiotics, real aggressive treatment, and stripping out those toxins out of the quarter so vigorously and regularly. Blood in the milk, I got a couple of queries about this in the last 3 or 4 weeks. Blood in the milk is often caused by hemorrhage from a kick or an injury. Again, if the cow's not sick, all these cases should be investigated. I'm just covering it at speed here. But blood in the milk is often is hemorrhage. So if we're seeing blood in the milk, fresh blood, and the cows aren't sick, we most likely have a hemorrhage in the udder. So if we're trying to stop that hemorrhage, we would obviously stop milking for once or maybe 2 milkings, depending on how much blood. Usually, if the hemorrhage isn't bad, it'll resolve itself. If it's quite bad, they need to be examined. Retained placentas obviously is when the afterbirth isn't removed in dairy cows. Again, what should we do around treatment? Should we treat them? If the cow's not sick, should they be treated at all? I think the key thing for people to remember is that certain cows will be more at risk, certainly in negative energy. Calcium is a big issue, and selenium has been linked into it. So treatment is about if the cows are sick or not, and that's a judgment you must make with your own vet. I would have typically used washouts, not parental antibiotics with these, and I would have monitored them closely. But I always focus on if there's a high level of retained placentas, there's some other issue with transition. energy number one, calcium, a huge issue in grass-based systems, and maybe selenium or vitamin E. Squamous cell carcinomas of the eye, again, certain breeds are prone to white lids, and again, it's a cancer of the eye. They'll appear with a small blinking, look like an eye infection, and you'll see this growth in the eyelid. Surgical removal is absolutely necessary because they get bigger and get quite big quite fast. And it's a condition we do see a little bit of over the summer. Hardware disease is where you have a cow calving, she has a wire in her stomach, and that wire, through the pressure of calving, will be pushed from the rumen. The rumen just lies beside the heart, in through the diaphragm, into the heart. And depending on how far in it goes, it'll often cause pericarditis. These cows will be in pain. They'll often have their legs out. They'll go off their milk quite quickly, and they'll have a jugular pulse. Treatment for these, magnets. Sometimes people talk about surgical removal, difficult surgery to do. Prevention is, this is why we see magnets in TMR wagons and stuff, just keeping wire away from cattle, because if they get into that lower part of the rumen reticulum, they can be pushed through at calving time to cause hardware disease. Warts, fibropapilloma virus in cattle. Again, contagious virus typically will affect younger animals because they'll have some immunity as calves. When that immunity wears off, you'll see it in particularly heifers. It can be a nasty disease. It can take several months for these to resolve. Depending on where they are, we'll advocate for surgical removal. I've tried lots of topical creams, and if they can be removed, remove them. I would say with warts that vaccines work okay, autogenous vaccines work okay, and it depends on farm to farm where they are. I get a lot of pictures of warts in cattle. What are these? Heart disease itself in cattle does cause problems from time to time. Pericarditis or endocarditis. So pericarditis, the lining of the heart. If you get infections in there, huge pressure on the heart. Endocarditis, where the valves of the heart get bacterial, mushroom-like infections. Again, these cows will go off their milk quite quickly. You'll see that jugular pulse in the neck. You'll often see that stance. And again, variable success to treatment in its long course of antibiotics to treat the systemic bacterial infections that have led to the heart lesions. Nervous ketosis, again, it's something we'll see occasionally. It's the extreme form of ketosis, and where these cows will appear excitable, nervous, and they'll often be licking bars, walls, and everything like that. So it is a differential for nervous type symptoms. Again, treatments involve intravenous glucose dextrose, supportive treatment, and again looking underneath the hood to see is there issues with the ketosis in the herd. I covered LDAs in a blog, RDAs. Again, this is a displaced abomasum to the right hand side. These cows get sick quite quickly, fill up with gas, they can twist. Treatment is surgical correction, and it needs to be done quite quickly, and it's not an easy surgery either, with variable responses to it. Managing RDAs, I think two of the risks are dietary changes around transition time and calcium as well as two of the things I'd look for when you see RDAs. Okay, getting there. Mange in cattle. I'm definitely seeing more mange in house cattle. Mites in the skin. We don't see them. It's a deep infection. It can cause intense itching. Variable responses to treatments down to different species of mites often, or could there be issues with resistance to some of the products? I don't know, but mange is becoming more of a problem. Again, keep things simple. Keep cattle clipped. Keep their tail clipped. Fresh air. Watch stocking densities, and time your preventative dose, antiparasitic dose as best you can over the winter to maybe minimize it down to 1. Again, lice, there's either biting or sucking lice, and they can cause very similar symptoms to mange, maybe not as intense itching or scratching. Again, lice is becoming more and more of a problem. I find clipping tails, clipping hair, maximising fresh air and watching space, along with a well-timed preventative lice pour-on, useful. Fog fever, again, this is an acute pneumonia we see in the autumn time in cattle. Why does it occur? It occurs because it's thought it's tryptophan in the grass that it leads to a cycle where it's an allergic type pneumonia, and we'll see it where we have a dietary change in the autumn. Symptoms, a lot of these mild symptoms will resolve themselves. They'll need some treatments, and if you're seeing high incidence, just look back through diet. Don't see as much of it as maybe once upon a time we did. I got a question about prolapse uterus in the cows. Why do they occur? Prolapse uterus in the cow is, it's quite a big event. Hard calvings nearly all the time is related. It could be related to calcium, but typically it's the hard calving. That cow is forcing. The calf pops out, the pressure in the uterus comes. Treatment is about getting your vet out as fast as possible. Keep the uterus clean till they get there, and avoid excessive movement with the cow. Leave her be until she gets there, and then getting that uterus in. And they're amazing animals because they resolve quite well, but it is a hard calving, so it's another reason why we avoid a hard calving. Watery belly, I got another question about this. Watery belly in calves. These calves that come with legs and head that are normal size and they're jammed, and it's this big belly of water. Your vet will often come out and have to release that water, and they're difficult. they're very difficult calvings. Like any calving, I think the key thing is, if you're not making progress, stop and ask why. Even if the legs look normal, the head looks normal, could there be a big balloon belly or water belly calf? Why do they occur? Genetic, don't know, is my answer to that one. Prevention, very hard to know. Is there genetics involved? Peritonitis, again, this is a symptom, but it's a very common question and very commonly diagnosed. Peritonitis is infection of the lining of the abdomen of a cow. And it can occur in sheep as well. Peritonitis can occur from bloodborne infections, from wires going through. It's often a side effect, and I've had them in the past after cesarean where you get infection. Very poor treatment response. It's antibiotics over a long period of time. And again, peritonitis is something you never see too much of. Identify it. Cows can go off the milk. They can shrink up to really just. I mean, you can imagine infection are in all around their guts. The severity of that. Red water is a bloodborne parasite, again spread by ticks. It can occur in cattle or dairy or beef. The symptoms of it are, as the name implies, urine that turns red from the breakdown of hemoglobin or red blood cells. You can get the change in colour of urine. Again, these cattle you won't always see that. They'll run a spike of high temperature at first. They can be constipated, and then they get quite scoury. Treatment is there's a licensed product called Imazole for it. Again, if they're very severe, they'll need blood transfusion. Prevention, young animals actually are quite immune, and animals that are on a farm that have been exposed to it have an immunity. What happens if we bring cattle from another place that has no immunity? You can get severe cases of red water. You can use the Imazole product as both a treatment and a vaccine. It is a massively long withdrawal. I think something like 220 days. Just be mindful of that. Joint ill in calves, got a few questions about this as well. Joint ill is obviously an infection of the joints in young calves. It can come from bloodborne infections through the navel, through the mouth. Typically in calves, if you're seeing a lot of it, focus in on navels, focus in on colostrum, focus in on hygiene. Treatments, if we get them early, we get a good resolution to them. Again, prevention is about focusing in on hygiene and colostrum. Diphtheria in calves, another condition I got a question about, was we'll often hear these calves that are this would often be diagnosed pneumonia. When you go, it's actually a stridor, where they're actually the upper airways close over to infection or in around the larynx or cartilage there. Again, any trauma with a stomach tube or dosing around that can increase the risk. They tend to be difficult to treat because it's quite a deep infection in cartilage tissue. It's not highly vascular. Diphtheria, I think, with it's seen there, antibiotics to certain families will work well. They need a long course of it, and if you're seeing an increase in it, look at feeding, look at what might be underlying factors. Your downer cow, I got a question about downer cows as well. Downer cow, loads of reasons for it: hard calvings, injuries, calcium. Cow might go down, why didn't she get up? It's there's huge pressure, huge weight, so you have to manage your cow when she goes down, first of all, to diagnose why is she down. Is it milk fever? Is it an injury? Is it mastitis? And I got caught as a young vet. I thought it looked like a milk fever. I never checked another. I'll never forget it. And it was an E. coli mastitis I missed. Downer cows need a lot of management. People talk about lifting cows. I'm very slow to lift cows. Put them onto a soft sod where they're not under pressure, moving them regularly, and avoid those hard calvings. Epididymitis, got a question about this as well, about testicle infections in bulls. It's common enough where you get a bacterial infection of the epididymis of the testicles, and you get bulls going infertile. I don't know the cause of it. Treatment, again, is antibiotic treatments work well in it. It needs to be diagnosed. You'll often see the white neutrophils on it when you do a fertility test on a bull. But remember, if their fertility is usually knocked out for 6 to 8 weeks afterwards, so that's an important point with bulls. Acidosis in finishing cattle, again, is due to dietary changes, particularly up to concentrate or starch concentration in cattle. So any dietary shift we're making in finishing cattle, do it, and be mindful of fibre. Acidosis, it really affects performance. It can occur in any animal. We typically see more of it in beef finishing animals where we're pushing them a little bit harder. So manage that fibre, water, and when we're increasing starch in the diet, we're doing it at a gradual rate. Timber tongue bacterial infection often causes drooling. Respond well to treatment. Again, it's more prolonged antibiotic treatment. Prevention, difficult to know what prevention. There's no real prevention that I've come across on timber tongue. Okay, so that's 48 topics. I probably didn't do them all justice. I just wanted to have a little bit of fun for video 48 to cover some of the topics that I missed, some of the key points. Remember, I'm going to have to take a break. Remember that I will be covering all of these again as I go along, and this is video 48, and I have 2 more left to do. My thought for today is every so often push yourself a little bit harder. Go out of your comfort zone. Give yourself, life is very short, give yourself a bit of a challenge. Today's challenge for me was the 48 topics that I would have liked to cover in this 50 and 50 challenge, but I didn't get a chance to do it. So that's it. Happy safe farming. See you tomorrow for the second last video. you.